Usually women with endometriosis experience excruciating menstrual pain. But how does this cause infertility? It can cause the fallopian tube to be blocked and prevent sperm from reaching the egg. That's one way it can prevent pregnancy. Another way is sometimes this retrograde menstruation can go back all the way and enter the ovaries. And when it gets to the ovaries, it just messes up the ovaries. One, it can lead to reduced quality of the egg produced by the ovaries. Two, it can cause complex cysts to be formed in the ovaries. Even though endometriosis causes infertility, just like many other things that I've mentioned today, you may still be able to conceive naturally. But in a case where you have been diagnosed with endometriosis and you have tried, you have had regular sexual intercourse during your fertile period for up to 12 months, regularly, without, and this has to be between a penis and a vagina, without conception, like without being successful, then the treatment for endometriosis includes pain meds. So like I said, endometriosis comes with severe menstrual pain. So you can take over-the-counter medications like ibuprofen or your Advil, Aleve, paracetamol, birth control pills. So birth control pills can help to actually control the hormones that stimulate endometriosis. But I know that you're trying to get pregnant, right? But first, let's try to control the inflammation around our ovaries. So this may take some months. Another medication is what we call a GnRH agonist. Now, what this drug does is it helps the endometriosis, that's the lining of the uterus found in all those places. It helps it to shrink. But the side effect of this is that it actually causes hot flashes, dry vagina, reduced breast tissues. So usually you're on these therapies for like a few months, like 6 months. Now when you're ready to get pregnant, you have to stop these therapies and then try to conceive naturally, which is simply calculating your menstrual period and trying to have sex when you're most fertile. But if pregnancy doesn't occur, there's also a treatment option for surgery. But I usually don't advise surgery when you're trying to get pregnant because if endometrioma has occurred, that is complex cyst in your ovaries, then the surgery is going to be on the ovaries as well. And then when the ovaries are healing, it will heal with minimal scarring, but this can also affect the number of eggs left in your ovaries. So if you're trying to preserve fertility and you have tried naturally, after being diagnosed with endometriosis, then another option is IVF, in vitro fertilization.